Grace, in a broader sense, what is mental illness and how do you so clearly diagnose it? There's no blood test for it.
No, there's not a diagnosis or a blood test for us. What we look at is the clinicians, the psychologists, the psychiatrists, the mental health counselors, marriage and family therapists, social workers. What we look at, what we talk about is what are your experiences? What are some of the symptoms that are happening? We talk about what happened before. I was talking a little earlier about the timelines. Was there something that happened? Was it situational? Is it something that's been around for a long time? Has it been happening since childhood? And so what we're looking at when we talk about mental health, because we've moved away so much from the word illness, from mental illness to mental health, because really mental illness has a stigma attached to it, a stigma that you're ill, there's something wrong with you, you're sick. That maybe like in the old days, back in like the 1800s, they talked about lunacy and you had to be a lunatic. That's how we all think about it. You're crazy if you have a mental health issue. But it's not. It's really about taking care of yourself and self-care and making sure that your thoughts and your feelings and your behaviors are all in a good, positive way, helping you adjust to your everyday life.
And I just want to add, so, especially when we're talking about mental health, people are constantly thinking about, it's all about your thoughts. But we're also, just like Grace said, we're looking at behaviors. What are the behaviors? Because behaviors are a symptom of the mental health issue. So sometimes I don't understand why, my teenager just stays in the room. It's frustrating, it's annoying. Well, that's a sign, that's a symptom of a mental health, it can be a sign of a mental health issue.